Well, welcome everyone. Thank you so much for tuning in. Hopefully you're here for the right event, the one entitled From Complicity to Resistance, in which we are discussing the demanding of an abolitionist and ethical model of social work and reproductive justice. My name is Lauren Ranowski. My pronouns are she, her, they, them, and I am an MSW intern with National Advocates for Pregnant Women and a MSW student at Columbia University. NAPW, founded in 2001, advocates for the rights of pregnant and parenting people, focusing on those who are most likely to be targeted for state control and prosecution: low-income women, women of color, and women who use substances. Now we'll take the necessary time to acknowledge the land. The land upon which we gather is part of the traditional territory of the Lenni Lenape, called the Lenape-Hoking. The Lenape people lived in harmony with one another upon this territory for thousands of years. During the colonial era and early federal period, many were removed west and north, but some also remain among the continuing historical tribal communities of the region. We acknowledge the Lenni Lenape as the original people of this land and their continuing relationship with their territory. In our acknowledgement of the continued presence of the Lenape people in their homeland, we affirm the aspiration of the great Lenape chief Tamanend, that there be harmony between the indigenous people of this land and the descendants of the immigrants to this land, as long as the rivers and creeks flow and the sun and moon and stars shine. Before we begin our discussions this evening, we would like to make three crucial points related to language and content. Firstly, people of all gender identities may become pregnant and seek abortion care. We acknowledge the importance of gender-inclusive language when discussing reproductive rights, with knowledge of the oppressive systems that target trans and gender non-conforming folks. Second, we will be referring to the commonly known child welfare system as the family policing system, due to the acknowledgement that this system does not prioritize the welfare of all children, particularly Black, Brown, and Indigenous ones. Finally, this talk will cover many different topics with the capacity to be distressing, such as the ones listed on this slide. Please know that if you are feeling uncomfortable or uneasy, we encourage you to take a break. I would like to take a second to uplift our four amazing panelists who have taken time out of their incredibly busy schedules to be here today. We'll give them an opportunity to formally introduce themselves prior to the group discussion, but I would like to introduce you to Dr. Alan J. Dettlaff, who is the Dean of the Graduate School of Social Work at the University of Houston; Kassandra Frederique, the Director of the Drug Policy Alliance; Joyce McMillan, Executive Director for JMacForFamilies and founder of JMacForFamilies; Caitlin Becker, the Managing Director of Social Work of the Bronx Defenders. Tonight, we will accomplish 6 things. First, we're going to cover logistics. Then we will have a brief 15-minute presentation. We'll do our panelist introductions, then our discussion, then the audience Q&A, and finally closing remarks. Okay, so now to get the housekeeping things out of the way. For the resource guide, this is going to be a comprehensive list of all of the sources that we are discussing in our presentation today. And that will be included in the email for all those that registered for this event. Also, if you are trying to see if you are trying to get CE credits, please ensure that you are signed into Zoom with the correct first and last name and email address, and you also must attend the entire time to receive credit. Thirdly, we will be having an evaluation survey, which is required for the CE credits. And next, we have community guidelines. For this, I want to say that it is important that we set the tone for this event, as it is one that is educational in nature. Topics that are covered today can be polarizing considering the political climate we find ourselves in, but we acknowledge that your personal or professional experiences may be different than those discussed tonight. Please understand that we are not hoping to create a debate space in this event, and our first and foremost goal is to highlight the expertise and thought leaders for these issues. Lastly, Zoom etiquette for today. We are utilizing the Q&A feature. So for any questions that come up during the presentation or as the panelists are speaking, feel free to utilize that as we will be getting to a audience Q&A later. But as most of you have been utilizing, we are also just doing general comments in the chat. Feel free to use that as you need. All right. So we kind of did this a little bit in the chat, but I kind of want to see what sector everyone is currently affiliated with. So give me 1 second and you should see a poll on the screen come up very soon. Perfect. So this gives us an idea of who's in the audience. As we know, social work can be super, super broad. So I think that should be up for about 30 seconds or so. So try to take time to fill this out. Cool. All right, so it looks like our top is medical and hospital-based social work. Then we have grassroots nonprofit, then other, and the other ones are pretty close. So I think that's kind of what we were imagining. Okay, so I know I briefly mentioned who we are and what our organization's mission is. However, I'm sure some of you may be wondering what a legal organization is doing hosting an event about social work. And some of you may very clearly, but while some of you may very clearly see that social workers must be involved in this discussion. Through our advocacy, we have been pointed to the social work role in or with partnership to these systems. Beyond traditional social work models, we've learned and recognized that there are alternative approaches social workers working with and or adjacent to these systems can do to minimize harm that pregnant people may be susceptible to. And we will drop the link to the chat for this in a little bit, but this is our chat. So that you can sign up for our activist update. So beyond just social workers, we know that many others are involved. Police and prosecutors, judges, healthcare workers, and child welfare workers are involved in the criminalization and family policing system. Although, as proof by everyone here, these are also sites for potential allies. The main goal of this presentation is to discuss the role social workers play in the oppression, criminalization, and surveillance of pregnant and postpartum people within the criminal and family policing systems. We want to envision a social work profession that addresses reproductive justice issues through a public health lens with a focus on family preservation, rehabilitation, empowerment, and individual dignity. As social workers, we are experts and skilled in understanding social issues at the micro, meso, and macro level. However, even at the micro or clinical level, it is important to acknowledge long-term consequences that their decisions can have on the other systems, on the larger systems. And so what we want to do today is to provide a historical context of these issues, pulling from an intersectional approach to illuminate how individual casework with clients or patients can be related to the larger community and society. I just want to take a moment to highlight this awesome Instagram account. Everyone should follow them. It's at mtoliver_LCSW. And this was a post that went viral. It's a quote that says, "I criticize the social work field so much because while I love it, I understand its power. A quote unquote helping profession rooted in white supremacy should constantly be criticized." Our ethical obligations set by the NYSED require us to uphold all 6 of these core values equally. As we know, this becomes challenging in practice. However, we are required to treat the communities we have the privilege of working with utmost dignity and respect. All 6 of these values are in jeopardy with the criminalization, penalization, and surveillance of pregnant people. A brief history of drug regulation in the United States. It wasn't until the 1800s that drugs even began to be regulated. They were treated the same way that they treated abortion. And it didn't happen until with the rise of immigration fears and economic anxiety during the late 1800s that people even started paying attention to drug regulation. Then in the Nixon era, the campaign on the war on drugs happened. This was not based on any science, and Nixon's own aide later came out acknowledging that this was a means to garner public support and jail Black people. We know that a lot of people view the war on drugs as simply a government-led initiative that aims to stop illegal drug use, but many now and then viewed it as a set of racist drug policies aimed to criminalize Black and brown communities for the same drug that white communities were using at similar rates, however, without the threat of police involvement. Then in the 1990s, the Just Say No campaign targeted victims of the war on drugs as opposed to those supplying the drugs. This led to harsh punishment for differing drugs that have the same root, so for example, crack versus cocaine. And also this led into mass incarceration with the prison population rising exponentially. The war on drugs started to grow in the 1980s when the public health crisis known as the crack epidemic was introduced. This response to the public health crisis was a penal approach rather than what we would now understand as a harm reduction or anti-racist approach. This myth specifically targeted Black mothers in low-income areas where drug use was viewed as synonymous with being unfit to parent. Most importantly, the crack baby myth was based on junk science, and there was no evidence to prove that there were any legitimate health concerns. As a result of the mass incarceration of Black and brown folks during and after, Black and brown indigenous communities are overrepresented in the family policing system. Dorothy Roberts says it best. If an outsider looked at the American child welfare system, she would likely conclude that this is not a system designed to promote the welfare of America's children. Rather, it is a system designed to regulate, monitor, and punish poor families, especially poor Black families. The racist and harmful messaging from media and state actors led to Ferguson versus the city of Charleston. This case went all the way up to the Supreme Court in 2001. This involved a South Carolinian state hospital which aided a local police department, tested pregnant women for substances, and provided the results of a warrantless search directly to the police department without the consent of the patient. This made a monumental impact on drug testing policy for public hospitals, and this mandated that surprise and non-consensual drug tests are a violation of protections under the Fourth Amendment of the Constitution. This case also showed that mainly Black mothers were targets. However, while warrantless and unreasonable searches have been deemed unconstitutional, pregnant people who may have engaged in substance use in the past or have positive drug test results today are uniquely classified for criminal charges, involvement in the family regulation system, and other forms of deprivation of liberty. So, as I said, hospital employees all over the country are continuing to drug test patients, and regardless of consent, based on state jurisdiction and practice, a drug test can lead to an open family policing case. And it can lead ultimately to arrest, charges, prosecution, or at worst, jail time. But most importantly, we know many cases where just a single hospital social worker intervention can directly lead to a deprivation of liberty. And that is the case in the case of Miss Lurcher and Miss Pedraza. Despite the Ferguson victory and more state federal movement to decriminalize illegal substance use, we are seeing an uptick of arrests due to substance use. But how many more are we talking? Well, from 1973 to 2005, there were only 413 reported cases. And then from the years 2005 to 2020, based on preliminary numbers by NAPW, we have seen at least 1,252 reported cases. So shockingly, arrests have tripled in half the time. Black women were disproportionately arrested, reported to state authorities by hospital staff, and subjected to felony charges. Nicole Martin, co-founder of the reproductive justice group Indigenous Women Rising, reports that Black and Indigenous folks experience the highest rates of criminalization, maternal mortality, and infant mortality, and that was the way the system was intended to work. I think we oftentimes try to say the system is broken, and this is proof that this is how it was designed. Now, I'm sure we might be wondering, what does the medical community and public health community say? Well, every leading medical and public health group has made a statement that criminal and civil responses to pregnancy and drug use harms patient care and health, and punitive policies and criminal prosecutions against women remain. The evidence is clear. The way to address pregnancy and drug use is to promote the health and to promote health for mothers and babies is through voluntary and confidential healthcare alone. With regard to policy, and shown in today's conversation, evidence and understanding of practice is crucial. Policies are generally, to a certain extent, enacted based on practitioner and research recommendations, but will continuously need to be held to that same scrutiny until they most accurately reflect the interests and needs of the most impacted by the criminal justice and family policing systems. So now we're going to get into more of the policy side. Firstly, for drug testing, clinical drug test results are not reliable and are not forensic evidence. A forensic test must be done to confirm validity, as false positives are common. And secret drug testing undermines the doctor-patient relationship. And finally, drug testing practices further discrimination and racial profiling. Bottom line is, positive toxicology alone does not signal harm. Now, we talked a little bit about the criminal system, but we're going to also I just want to briefly mention how that differs in the FPS. So for the FPS, a positive tox case alone can lead to an open FPS case, even when there aren't any other allegations of abuse and neglect. And what's at stake? Civil penalties, addition to the child abuse registry, family separation, trauma, financial loss, criminalization, and so much more. For those of you working in the medical field, you may already know about CAPTA. Many states and local child welfare agencies have assumed that CAPTA, a federal funding provision, requires them to report all substance-exposed newborns to child welfare agencies as being abused or neglected. But this assumption is incorrect. CAPTA does not require this. It doesn't require to report all substance-exposed newborns to child welfare agencies. It doesn't require testing of newborn babies, filing abuse reports, or involving CPS in the plan of safe care. The only thing that it does require is that states must have policies and procedures to address this, and that healthcare providers involved in the delivery or care of such infants notify CPS of the occurrence of this condition. But no identifiable information is required. In New York State, the Department of Health guidance says that a positive toxicology report alone does not support a report to ACS. And that, of course, most of us know this is only required when acting in our official capacity. What is required to be reported quarterly is newborns with withdrawal symptoms and a positive tox if they're diagnosed with NAS or FASD, but this is only required to be reported quarterly with de-identified data. The only thing that signifies a report to SCR or ACS is if there's reasonable cause beyond substance use. Toxicology is not recommended as routine during pregnancy, delivery, or for the newborn, and the provider is required to obtain explicit consent prior to the screen. This is a pretty helpful flow chart, and this will also be included in the resource guide, and this kind of just helps you walk through maybe a day-to-day situation when you're practicing at work, and that way you know if a report is required. So sorry. So why are we all here, right? So we're talking about an abolition lens. The goal and the hope is that we are able to completely abolish the family policing system. I want to highlight one other Instagram account, Abolitionist Social Work. Many of our panelists, if not all of them, are affiliated with this group. They're doing incredible work, and I would be remiss to not highlight the work they're doing. They are also hosting an event with Joyce and Dorothy Roberts, and I'll share that information a little bit later. Dorothy Roberts says, abolition means completely dismantling the system of family policing, not reforming it or replacing the current system with a new and improved system. It means ending its philosophy, design, practices, and policies, and building a different way of caring for families. Lastly, Joyce says, any system built to protect children should in no way mimic a system that was built to punish adults. So now we are going to get into the panel discussion. So I want to go ahead and transition into this. So since we've laid a foundation of the historic and current day oppression people face in our country with particular regard to pregnancy status and pregnancy outcome, we will now enter a panel discussion to dive deeper into these issues. We will hear from expert panelists on ways practitioners can support pregnant and parenting clients and communities from a harm reduction approach with the goal of moving towards an abolitionist framework and practice. So I want to start out our discussion by saying thank you so much to our incredible panelists for participating. And let's go ahead and start with Dr. Allen.
Hi, everyone, and thank you for the invitation to be part of this event with all of you tonight. I really appreciate all of the organizing that went into this, and I'm really excited to see all of my fellow panelists tonight. It's really good to see all of you. My name is Alan Dettlaff. I'm the Dean of the Graduate College of Social Work at the University of Houston, and one of the co-founders of the Upend movement, which is a movement that focuses on abolition of the family policing system. I'm also a former family policing agent. I started my career as a social worker working in the family policing system in the mid-90s to early 2000s. So bring a lot of my personal experiences working in that system, investigating allegations of maltreatment and being responsible for removing children, being complicit in that harm to the work that I do now. So I'm really happy to be with you all tonight.
Let's go over to Kassandra. And thank you so much for coming out here. I know you're feeling under the weather. Like, that is truly so much dedication. So sorry you're not feeling well, but thank you so much for coming. That's amazing.
No problem. I'm just going to sound a little bit like Kermit the Frog. So my name is Cassandra Frederique. I use she, her pronouns. I'm the executive director at Drug Policy Alliance. I got a degree in social work. I believe in the abolition of the profession in general. And I'm based here in New York City. And I'm really excited to be here because so much of what I've learned about the drug war and social work and the family policing system has come from advocates like Joyce McMillan, Dinah Ortiz, Lynn Paltrow, Emma Cunningham, Caitlin Becker. And so very excited to be here today with you all.
Well, that's perfect, because I think that's a great way to transition into Joyce. Would you mind introducing yourself?
You're on mute.
You might be on mute.
I'm glad I started off with a frog in my voice, and I was going to blame Kassandra because I just blame her for everything. But my name is Joyce McMillan, and I am the executive director of JMacForFamilies and the founder of Parent Legislative Action Network. And I'm just happy to be here with these greats, right? Caitlin, Kassandra, and of course you, Alan. And thank you, Lauren, for inviting me. And I'll just deliver as the panel opens up. I'm ready for this.
I'm so glad you're ready. I'm feeling the energy. I'm ready. All right, last but not least, we're gonna go ahead and have Caitlin introduce herself.
Hi, good evening, everyone. You just leave the mic on Joyce, because Joyce does deliver. She will and never disappoint. I'm Caitlin Becker. I'm the Managing Director of Social Work at the Bronx Defenders. I have had the great privilege of being in community and collaborating with Joyce and Kassandra over the past 11 years since I came to Bronx Defenders. Alan, I haven't had the chance to work directly with, but I'm really excited to be in conversation with all of you. I am a social worker by training. I have been representing parents in cases brought against them in the family policing system for these past 11 years. And the practice that I run now includes social workers who represent people who are charged in the criminal legal system, as well as social workers and advocates who represent parents in the family policing system. And I'm really glad to be here and in conversation with all of you today.
Amazing. Yeah, I mean, I think you said it best. Like, this is, when I was like, I was so excited about this panel because I feel like this is like the Avengers of like repro, like all of the great people are here, and I really appreciate it. So let's just get into the first question. Given our common backgrounds in social work, impact, and justice, from your perspective in work, why is the issue of state control of pregnant and postpartum people's rights important for us to discuss as social workers and advocates? And anyone can go, anyone can jump in.
For me, I was separated from my children because I utilized a substance. And a drug test is not a parenting test. So right there is the importance. You cannot judge how well my children are being cared for without assessing their needs being met and only judging me for making decisions as an adult. It leads to over-policing. It leads to overstepping of boundaries, overreach by government officials, mandated reporters being in fear of not reporting, just reporting to be better safe than sorry. And the harm it causes is family separation, disproportionately people of color.
Yeah.
So from a social work lens, you're thinking of like the profession. One of the foundational values of social work is persons' rights to self-determination. That's taught probably from the first social work class that any social work student goes to. And self-determination is control over people's bodies, control over the decisions they make regarding their children, control over how they care for and raise their children. And social workers and the social work profession, through their work with endorsement of the family policing system, violate all of that. The family policing system fundamentally violates parents' abilities to care for and raise their children. And then when the state chooses to invest its resources into a system that's based on punishment, like the family policing system is, rather than invest its resources in providing parents with what they need to raise their children, when the state allows millions of children to be raised in poverty, then the state is violating parents' rights to raise their children in the way that they would like to raise them. So when I think about reproductive justice and the origins of reproductive justice, it was about more than just access to abortion. It was about freedom and self-determination. And particularly for Black families, the family policing system denies all of that for them. It violates Black parents' abilities to care for their children.
Right. When did it become a crime for your children to walk home from school alone? We got this new thing called free range parenting or something, meaning your children come home from school alone or go to the playground alone. That's what we did. When did it become a crime? It became a crime when we realized we could capture more Black bodies, because it's more relevant that a family who struggles financially would not have a sitter take their children to the park, but an older sibling. And so when we look at these laws, we look at the idea that they're built around having a limited amount of resources, financial and otherwise, which makes it easier to grab those bodies.
I was just wanted to add to what my colleagues have shared. I think for social workers in particular, to just be really explicit that it's social workers who are doing the policing of pregnant and postpartum people. It's us. We are the agents of state control, as Alan mentioned. We are the hospital social workers initiating cases against parents who give birth and test positive for a substance. We are the drug treatment providers reporting positive tests to the criminal system, which leads to oftentimes incarceration immediately and family separation in the family system. We are the decision makers in the family policing system, deciding whether babies go home with their mothers from the hospitals, whether they're separated, whether they have visits, whether they are able to breastfeed. These are decisions that social workers are making at every point in every system that interacts with people who are pregnant and with people who are postpartum and trying to parent. I think we've, you said it in your introduction, really, the system, the reporting that is happening at every kind of juncture in the system, it's not good for babies, it's not good for parents. It doesn't lead to children being better off or babies being in, kind of better situated because there is a report against their parents. So just to be really explicit that we are the police at every point in a system that's working with pregnant and parenting people. And this is not a system that is about support. I can't tell you how many hospital social workers I have talked to who have told me that they have called in a case, not because they worried that a child was neglected, but that they knew that this parent needed support. And to just be really explicit that this is not a system that's about support. It's a system that is designed to surveil, investigate, bring charges against parents. It's a prosecutorial system. And if what you are intending to do is get a family support, then that's a different system altogether, or a different question altogether. It's not anything that should be done in the systems that we operate in right now.
If I could add just quickly, I agree with everything that everyone has said, which I think is going to be the line that we say often, is that this is also, I would like to just span it out, and like, this is an issue of autonomy, right? And this is an issue of surveillance, and the idea that we could have systems that can control the bodies of people that we find to be more marginalized. The state of being pregnant and of postpartum in the eyes of the state puts you at a place where people feel like they can make decisions for you. And that doesn't happen to everyone, right? That happens to certain kinds of people. And I think if we look at the history of the family policing system, we know that Black and Indigenous people were the people that were most likely to be seen as the ones that they could make decisions for. And we see with the cases that NAPW brings forward, especially for white parenting people in rural places in the US, that there is a value system that is put on certain groups of people that then dictate who has the rights and the liberties to make decisions about their own bodies. And so I think this is an important point for us to have as social workers and as advocates. But I think there's a fundamental underlying assumption that needs to be disrupted, which is about who has what right to their bodies and who has the ability to make decisions that are different than others, than the decision makers. And so as we talk about this issue, part of the reason why this issue is important to the work that we do and that I do is because my work is at the intersection of health, justice, and autonomy. And oftentimes we have lots of conversations around health and justice, but we don't often have conversations about autonomy. And I think sometimes that's because the right has co-opted what that can mean, right? Because they have the right to, I was about to curse. They have the right to mess other people's lives up. They have the right to fuck other people's lives up. That's the right that they want, right? And what we're looking for is the right to just be. And I think as we're talking about parenting folks, we're talking about women, cis and transgender nonconforming, like that population, right? Trans men have are the people that have the most scrutiny as to whether or not they have autonomy around their bodies. And then if they decide, if you decide to be, if you are a cis, trans, gender non-conforming person, then have the misfortune in society to not be white, and then to also be poor, it really dilutes your ability to make decisions about whatever you do. And then you decide to be a parent, then you decide to reproduce. It's like, no, we need to control you so we can control what you can continue to reproduce. And so there's this really fundamental element that needs to be disrupted and shifted, because that decision-making power is something that we're still negotiating, and it's not a negotiating point, right? Like, Joyce exists, so Joyce gets to do what the fuck she wants to do. And it should not be a discussion.
Yes. I get to say it. But, hearing Kassandra, it takes me to a place. I would be remiss if I don't start the framing of this conversation and talking about the parallels. Because when we talk about the parallels, we create a framework that makes us understand why and how we are forced to do what we do, even when it's not what we signed up for. Caitlin became a social worker not because she wanted to disrupt and destroy people's lives, right? But the way the framework is set up, that's exactly what they put people in the position to do. And now I'm grateful to have social workers as advocates pushing back and saying, no more, this is not what I signed up for, I won't do it. So the framing is that we have two systems, as we spoke about earlier. Joyce said, any system built to protect children should in no way mimic a system that purposefully punishes adults. You have children and adults, children being strip searched under the guise of checking for marks and bruises. Even though we know more than or close to 90% of the cases that come under their radar are for reasons related to neglect, not abuse, but we still strip search. They're both separated from everyone and everything they know and love. They both have set visit times on set visit days. They both eat what they are served. They both change homes and cells regularly. They both use garbage bags or pillowcases to change locations. And in lieu of time, they're both paroled back, either to their family or to the community. And we're utilizing the same language in both systems as well. And they say they're child protection services, but we look at the outcome and the only thing we see them protecting children from is success. But it goes deeper than that, because we have to also look at the 13th Amendment, where in America, it's the only way to have slaves in this country. And when we look at who's disproportionately impacted and the outcome of the number of children that enter the prison industrial complex, they call it a foster care to prison pipeline. I call it a foster care to prison prerequisite training, because it's the exact same thing happening at both locations. We are preparing you for the outcome that we are setting you up for. And then comes in all these other things, like the drug testing at hospitals, where a hospital is the place that should be supporting a person who has a drug addiction, if they have a drug addiction. And if it's just that I choose to utilize a substance, leave me the hell alone. That's my business. So, we have to look at that framework to understand why systems operate the way they do and why they work together and why there's this over-reporting, because there is a setup to fail and a setup to make sure that the next generation of prisoners or slaves are always entering the prison industrial complex.
Just going to offer some space for that. We're just going to offer some space for that, because you said it. So I just want to offer that, Yeah, in the chat. Yeah. So you already talked about how the family policing system is an extension of the carceral system. You articulate that very well in your work, and it makes a lot of sense to me. And I'm wondering, and this is going to be bouncing back to you, Dr. Allen, what role do you think social work education plays in reckoning this? Is there a responsibility for social work educators to be, not offering just this limited traditional approach of the mandated reporting that we all hear? What do you feel about that?
Yeah, absolutely. Social work, schools of social work have a huge responsibility in this. First, thinking of the code of ethics and our ethical responsibilities as social workers. Just last year, NYSW made a revision to the code of ethics that said that social workers must take action against oppression, racism, discrimination, and inequities. And it's the only place in the code of ethics that uses the word must. That means that social workers must take action against the systems that are responsible for oppression, racism, discrimination, and inequities. And that is the family policing system. We have to start by calling the family policing system what it is and saying that social workers ethically should not be participating in a system that's responsible for harm and oppression and racism and inequities. A colleague of mine, Victoria Copeland, that I know all you panelists know, uses the term mass refusal. And I think that's where social work needs to get to, the place where we just say, no, we're not going to continue to be complicit in this anymore. And that starts also with advocacy to NASW. NASW, our professional organization, support 100% of the workforce of the family policing system being social workers. That's their policy stance. We have to advocate for NASW to demand change as a part of this mass refusal movement. And then some of the other things that the panelists have talked about, we have to be talking to our students about substances and ensuring that students or future social workers understand that not all substance use is harmful. Not all substance use needs to be reported. We have to be talking about harm reduction and what the family policing system does when in the way it treats the use of substances, where all substance use is bad, all substance use is labeled as a risk factor. We have to be educating our students differently so that they understand many parents use substances and parent their children perfectly, particularly rich white parents use all kinds of substances and parent their children and never become involved with the family policing system. So students need to understand the reality of what the system is doing.
And I think Joyce has a really good example of the way you have been working with social work education. I just wanted you to talk a little bit about your mandated supporting work with SWAM.
Yeah, I think that everything the system does, we need to do the opposite of. So instead of reporting, we need to be supporting, right? And what does supporting mean? Why would I call, as an example, in a hospital setting, again, back to that, why would I call Child Protection Services to report a family because mom utilized a substance that you only found out she was utilizing because you stopped and frisked her bodily fluids, right? And stopping and frisking of people's pockets was deemed to be unconstitutional back a few years ago. And we don't do it on the street anymore in the criminal justice, in the world of criminality and in policing, but we do it in a hospital setting. How is that okay? If I'm in school and I say to my kid's teacher, we don't have food to last for the weekend, ACS, CPS across the United States is not coming with a bag of groceries, right? They're just coming to verify that you don't have food. So what we need to be doing is utilizing people to support families instead of reporting families, because most people have the resources that they can refer families to when they're in need. And keeping in mind that the majority of calls are for reasons related to poverty. That is framed to be neglect under CAPTA. And I just want to say today, I'm coming for CAPTA. I'm coming, right? Because it's the foundation. We talk about ASFA, but it's CAPTA that lays out what maltreatment is, what neglect is versus abuse. And it's CAPTA that mandated reporters fall under, and I'm coming for it because we need to change it.
I totally agree. And I just want to add and kind of build on what Joyce just said. And the mandated supporting curriculum that Joyce and some colleagues have developed is so critically important, because what social workers are taught is to report without question. Report, it's not your job to investigate. And so when in doubt, report. What happens, naturally happens. Of course, social workers are reporting because that's all they're told to do. And that's all the mandatory reporting kind of training offers. What social workers don't know is what happens after the report is made. They're not coming with a bag of groceries. They're not making referrals for treatment, even for parents who say, I want treatment. They file a case in family court, ask for separation, do an emergency removal, and ask a judge to co-sign that removal. It is not about getting those families, even families who want support, treatment, things like that. It doesn't happen. And so making sure that social workers understand what happens after a call is made, what happens when ACS and the police knock on the door in the middle of the night, ask for your baby to be strip searched and take off their clothes and look for marks and bruises, all because of a positive test for a substance where there is no impact on parenting whatsoever. And that happens every day, all day, in every jurisdiction in this country, because of calls that social workers make. And so understand, I think, the impact of what happens after that call is made. And we have to be critical of our profession. And I'm not sure about this social work profession of ours, to be honest. I think we need to be very critical of what this profession that we have bought into is doing to the families that we say we're serving. We are not valuing human relationships if we are monitoring, surveilling, and supervising families. We are not valuing the dignity and worth of the person if we are subjecting parents and children to an intrusive investigation. Terrorizing children, emergency removal, is the scariest thing that you could even begin to imagine for a child or a parent. And there's not social work curriculum, social work schools don't talk about what happens. And it don't talk about the harm that we perpetuate every day. And I think we need to be much more critical of the profession we've chosen to.
And what's very interesting, after you make a report, even if you called and asked what happened to that family, they will not tell you. They will tell you it's confidential. Even though you are the reporter, you do not have the right to understand how the family is faring after you made that report. They do everything in secret. Everything they do is in secret. And that's why today I'm pushing for Miranda rights for families, so that they can't continue to do things in secret. They need to do it out in the open. They need court oversight. When they knock on your door and come into your home without court oversight, then anything they do is subjective to their own implicit biases.
Yeah, you said earlier, Kassandra, that you're wanting to work yourself out of a job. Essentially, you're wanting to abolish social work as a profession. I want to know if you could speak a little bit to that.
I mean, I don't think in a world where the world that we are trying to build, I don't think we would be having enforcers of, as Dorothy Roberts says, benevolent terror. I think our help in this country comes with stipulations, and it comes at a cost that's really high. And so when I talk about the abolition of the profession of social work, I'm talking about the concept of that care has to come with conditions. And that the idea that part of our work is to make the despicable more sightly. And when I say despicable, I'm not talking about people, I'm talking about the conditions that the country has put people under and that people are having to endure under, and that social workers are supposed to put a Band-Aid on it, as opposed to joining with the gentry to rise up against the disrespectful, despicable conditions that they have us under, right? And so I think there's a complicitness in our in the institution of our profession. I think the stories of Jane Addams and Mary are like, they need to be complicated. I think it is part of this idea. I think there is a straight line between social work and the Karens of today. There's a straight line. And in order for us to be honest and truthful and rigorous, which is what abolition requires, we have to really pull out what those things are. There's a reason why we are having multiple issues of white women interjecting in situations that are not their business. and calling the police officers when someone is barbecuing, or when someone is bird watching, or when someone is rollerblading in the park and there's a sign, and they feel that they, as an individual private citizen, can interject and disrupt and harass young people of color, right? Young trans folks hanging out on the bridge. There's a straight line between Jane Addams and Karen's. And that as a profession needs to be abolished, because it's the underlying assumption that lets you know that you don't even got to get paid by the state to do the state's work. And that's the problem, because oftentimes the overseer got a lot of helpers, and that is what social work feels like to me. And they say that this is how it has to be in order for me to get help, then I'd rather not. You know, and I definitely think there's different ways for us to support our communities outside of one that gives us the outside of the structure that is about surveilling each other.
But listen, when we talk about social work and these systems and slavery, my thing is slavery, because I see so clearly how it's related, right? Like pushing people into prison, but also look at the language. When ACS goes out of their office, outside of their office, they call it what? The field. When Black folk were in slavery and they were on the plantation, what was it called? The field. They go out into the field. They go out into the field and they find people who cannot have conversations with their doctors, their teachers, their therapists, or any of the people who should be readily available to provide support, because those people are mandated to report. So what does it do? It creates an atmosphere where people are hiding whatever their concerns are that they may need assistance with, and they are setting us up for a situation where they get to go hunt us just like they did when we ran away. It is all the same thing being utilized with different languages and different mechanisms. 2 weeks ago, I was at the American Bar Association, and a white lady, God help us all, said, I've met one person in my life who really enjoyed parenting classes, and I've been doing this work over 30 years. She said, but she was angry. And I'm like, what does that have to do with anything? And why wouldn't she be angry? Would you be angry if they took your kids? Right? She was angry. We can't even be mad at what they're doing to us. I told her to go stand in the damn corner because she needed to be punished herself, even for saying that. It's really the slave system. Every which way you dice it and look at it. Someone else also said, yeah, well, we don't call it visits anymore. We call it family time. Mm-hmm. And I'm like, but what has changed other than the title? You're still overseeing people during the visit. It's still a set time at a set location. The parents still don't have the right to take their children even to the corner store from the location. And this is someone who maybe their child missed too many days of school, played in the park by themselves, fell off a swing. None of this is abuse. The abuse is coming from the system. The system is not just abusing the parents that it captures, but it's abusing those who should be available to support families. And I don't think any social workers have to work themselves out of a job. I think they just have to change how they work.
Thank you so much for all of this is just so good, and I just want to continue to offer space, and I think there is a lot to say, because when I was in social work school, I remember a lot of people talking about mass incarceration and police brutality, but they were not talking about the harm we were doing. You know, they were not talking about how social workers were cops without guns. They were not talking about the way, so we are continuously, the institution of social work is continuing to oppress and continuing to harm. Joyce, you mentioned a little bit earlier about how a lot of times people end up with open, ACS cases as a result of poverty. I'm curious if anyone wants to speak to how the family policing system is in a lot of ways a criminalization of poverty, and we're not addressing resources and we're not addressing root causes. And also speaking to why, and I'm sure maybe Kassandra, you can speak to like, why are we even caring about the substance use and parenting issue so much, right? Like, why is this even a thing? How do we move towards a profession where we can value the autonomy and dignity of the person, and we are able to allow adults to be adults? So I'll start with Joyce, and I'm curious for you to elaborate more on that first point, and then maybe we can bounce it to Kassandra.
I don't want to go off the rails. What's the first point? Why don't we let Alice start?
I'll just follow up on what Joyce said about the system being largely criminalizing people who are living in poverty. I think what probably a lot of people watching this don't realize that only 17% of children who are in foster care are in foster care for what the state classifies as physical or sexual abuse. More than 70% of children in foster care are in foster care because of what the state classifies as neglect, which is largely related to poverty. And so what we see happening is a system that takes children away from their parents because of largely poverty-related concerns, and then places those children in the homes of strangers that they call foster parents, and then pays those strangers money to take care of someone else's children when all those children's parents need is money. So, and that's how this system is not just an arm of the carceral state, but is an integral part of the carceral state, in that it operates under that same logic where we punish individuals for being poor rather than acknowledging that the source of poverty, homelessness, joblessness, those are societal failures that the state should be addressing. But rather than doing that, we punish individuals as a specific means of distracting our attention away from the fact that the state chooses not to address poverty. The state chooses not to address houselessness. The state can address those are policy decisions. It creates it, absolutely. Creates it and chooses not to do anything about it. But instead we punish individuals because they're poor.
The reason why I'm so happy to be here and just happy in general with the work that I do is because I get to work with Caitlin, I get to work with Kassandra, I get to work with Alan, and also Lauren and others that do work like them. And that's important because we have to come out of working in silos. We have to stop working in silos because the government does not work in silos. The government will partner with any and everyone who will report, but they will never partner with Tide. They will never partner with a housing project that gives someone a place to live. They will never partner with a furniture store or a food pantry or a supermarket. They don't partner with places that can help and support families. They partner with people who they demand report families under this CAPTA and this mandated reporting thing that goes along with that. And so these reporting mechanisms, they create poverty in and of themselves. And I'll say, as an example, before we changed the state central registry in New York, you would stay on the registry until your youngest child turned the age of 28. My youngest child recently turned 22. Had that law not been changed, I would be on the registry for another 6 years. With that being said, that's my youngest child. If one of my children had a child and needed me to be a resource, that child will go into stranger care before it would be allowed to stay with me. And then they would say, generationally, the McMillan family is bad. See, 3 generations have been involved with foster care. But it's not because we're generationally bad. It's because you have created laws and policies that created the recidivism that you now create narratives around to make people think what we're doing is wrong so that you can throw the rock, shatter our glass, and blame the shattered glass on us. It's not on us. You have the power, as the government has the power to change. And we have the power to work together and say, not anymore, because we like to blame things on systems, and nothing frustrates me more than when a system worker says, it's not me, it's the system. The system is a structure. You are the one that hold that structure up. You are the one that have to make changes. You are the one that have to acknowledge the wrongdoing and the role that you are playing, and you are the one that has to begin to think about how to do things differently. Stop telling me about the system. You are the system.
Period. I'm gonna let that air out a little bit.
Cassandra. Just be ready for Saturday.
Listen, I'm on the team. I'm tweeting. I'm like, yo, JMacForFamilies, why am I here? You asked the question about substance use and pregnancy, Lauren. And I want to be really clear about certain things. Because part of the questions that you offered beforehand talked about how decriminalization of cannabis and other drugs are gaining steam in this country. And I want to be clear, they're gaining steam for some people and not others. They're not necessarily gaining steam for pregnant people and postpartum folks. And I think that this is something that folks like Lynn and NEPW, why the organization has been so important, is because the drug policy movement, though, is like, oh, like health, equity, autonomy, we have rights. And then we stick the pregnant people in the corner, right? We don't actually have them at the table, because when we're talking about people got the right to use mushrooms and weed, we also put the people that using heroin and crack in the back too, right? We don't really want them in the front. And, you know, in our movement spaces, folks that are using substances that are not as, the folks that are using substances that are racialized and povertyized, right? Not rich people drugs, not weed, not mushrooms, not coke. I'm talking about heroin. I'm talking about crack. I'm talking about the meth, right? The world is, there's hierarchies, right? And even in that movement space, you know, the first time that I saw Lynn Paltrow talk, it was at a DPA conference where she was speaking as a keynote, and she was like, don't have me come here again and you refer to these issues as collateral consequences, right? And that was really impactful for me, because that framing makes it as the side, as opposed to the fact that it is actually the war, right? And that there is a war that is intentionally, they're not, by the way, targeting people who are pregnant and parenting. They are targeting people who are pregnant and parenting, right? And in our campaigns around decriminalization, what you're seeing is that folks are still scared to stand up for people who are pregnant, parenting, and postpartum. People are still scared to say, when we're having big conversations about supervised injection facilities, people don't want to talk about the fact that people who are pregnant should be able to walk into a supervised injection facility and be able to use those services, because that is still safer than them using and injecting by themselves, because the drug supply is poison, and because we want people to be connected to services, right? And so our movement has done a lot. But when we look at the studies, if we look at the rates of reporting for pregnant people in legal cannabis states, right? So the state of Washington, there was a study that came out. Washington legalized cannabis in 2012. But if you looked at the years later, while the arrests went down, the reporting in hospitals skyrocketed, and Black parents were like getting their kids taken away at astronomical rates, because the enforcement just shifted, right? And the system is going to eat. If you move something, it's like whack-a-mole. The system got to be fed. So they will continue to find the people, and they will find the people that our larger mainstream movements decide to ignore and throw under the bus. And in fact, we feed it to the people. So we in our drug policy movement are still struggling to not feed pregnant, parenting, and postpartum people to the system, because we believe that we will get free if we just give them up. But the truth is, if we're not focusing on the people that are most under the scrutiny of the state, then we're never actually going to win. And that state is still going to be able to create that power. If we're trying to take power away from the state, then the way that we do that is by taking the power of control and incarceration and stigmatization and criminalization from the people that they are most committed to holding on to. And if we are not willing to build campaigns that do that kind of work, and I'm not saying it's easy, because we already struggle with the images associated with drugs. Adding the image of pregnancy and parenting to that is a different emotional marker. It is a different emotional marker. It just inflames the whole conversation. But we have to build the muscle to stand with those people, because at the end of the day, those are the people that potentially need the most support in the moment. And so it's really, and you see the parallels, as Joyce will say, where you can go to the Bronx and you'll see the lines of what kind of families that are standing in family court versus the moms who are writing op-eds about how they drank during the pandemic to deal with their children, how they smoke weed to deal with their children, how mushrooms have enlightened their parenting. It's the same strategy over and over again. Every time they want to mainstream a drug, they put a white mom up there and they say, and that white mom comes out the closet of what substance she uses that makes her life better. And so it's important for us to watch to see what we're allowing people to do, but also recognize that the movement of drug policy is still literally working against ourselves, against this work, against pregnant and parenting people, against reproductive justice, because of the ways that we build our campaigns and the ways that we build our narratives. DPA is a part of that as well. And it's work that we're trying to be better at. And also like that we have to be really cognizant of, because the drug policy wins that are happening in this country are not happening for everyone. And they're certainly not happening for pregnant and parenting people, especially as we see the rising cases of the death penalty for people, for pregnant people, and the rising rates of incarceration of pregnant people when it comes to using different kinds of drugs for self-managed abortion or illicit substances like we're talking about now.
And here's the thing, when heroin became a big thing, it suddenly became a health issue, a mental health issue. When crack was a thing, they were 50,000 kids in foster care. You understand, in stranger care, because there was never anything built to support the families to find out what the underlying issue was, to have them receive treatment with their children at a facility. White parents get to go to treatment facilities, and just showing the racism during this time, we already had plenty of CPS offices in Black communities. Tell me where are CPS offices in Riverdale or Bronx? Tell me where are CPS offices in Bensonhurst and Brooklyn? Tell me where are CPS offices in Soho or Battery Park in Manhattan? And that's throughout the 5 boroughs that these CPS offices are strategically placed in our communities. And part of the problem is, I always make an analogy about me drinking orange juice in the morning, right? Fresh squeezed. And I don't like pulp in my orange juice. So I strain it over and over and over and over again. And after straining it about 10 times, I can drink it. There's still pulp, but it's enough pulp to tolerate. And that's what America does to Black people. They strain us. From the moment we leave our parents' womb, they begin straining and filtering us into systems. They come up with every idea in the world to find ways to separate us. And so when we get to the age of being a teacher or being in an executive at an organization, there's very few of us there because they have strained us out along the way. So my chances of finding a therapist that looks like me, I didn't have a teacher of color until I was in high school, right? So there's always going to be these implicit biases. There's always going to be this ideology that we don't line up and we're not worthy because we're always in the space, even when it's supposed to be our own space. My school and my community is still an outside person in that space judging me and feeding me into a system. Either they're saying, she was playing rough with her friend, she needs mental health. They're saying she did this, we're gonna call the police. We have police in Black schools. Even though white kids shoot up their schools, there's no metal detectors and police in their schools. So again, it's the whole framing of how we do what we do. Yes, these problems exist, but what we gotta do is tear down this framework. And that's why I'm all about abolition.
Yeah, I just want to kind of bring the discussion a little bit more back to the social work education, just to kind of think about like, so abolition in social work education has only been recently entering the mainstream, I would say, in the last 5 years. What strides, if any, have we made in the social work academia space, and where do we need to go from here on out? And I specifically am curious to hear what you have to say, Dr. Dettlaff and Caitlin, since you work a lot with social work and social work students and recent grads. But yeah.
So yeah, thanks for that question. I think it's important, and I'm seeing a lot in the chat from people who are working, social workers in the system too. I think the conversation has definitely changed in many schools of social work. Abolition of family policing system wasn't something that was talked about at all a few years ago, and it's talked about often now. And I know that a lot of schools are wanting to learn more about it. I think progress is absolutely being made, but I think the real challenge for social work is that we have to stop telling ourselves that it's possible to create change from the inside. Social workers have been telling ourselves that it's possible to create change from the inside for decades. And there's literally evidence that shows that that doesn't work. We've been working in the family policing system since at least the 1960s, and it's still horrible. We've been partnering with police and in prisons for decades, and it's still horrible. So the whole idea that we can create change from the inside keeps us in these systems. I saw someone in the chat say something related to, shouldn't social workers stay in the systems because then we'll make it better? No, we shouldn't. We shouldn't stay in the systems. The whole idea that creating change from the inside is not possible because the system doesn't want to change. We as social workers going into the system might make it a little better, a little nicer, but that's not enough when the system is fundamentally governed by harm and oppression and the subjugation of people. So the idea that we can create change from the inside is a lie that we just can't accept anymore. And that's what needs to change within social work and the way we talk to our students about it.
I'm glad to hear that Alan sees progress, because I think it's minimal, the progress that I've seen. I think it's happening, and I think it's important. And it's important there are more conversations like this that certainly didn't exist 10 years ago. Dorothy Roberts called for the abolition of this system 20 years ago in her first book, Shattered Bonds. This is not a new conversation around abolition and family policing. It's new because some pockets, I think, of social work education are starting to see it and understand it. And I think that's really important. But I do think we have a lot of work to do to make sure that that message is broader and that everyone reads everything Dorothy Roberts wrote. If you work with families, if you are ever working with anyone impacted by any of these systems, and every single one of you will, you have to read Shattered Bonds, The Color of Child Welfare, and you have to read Torn Apart. Look at me, I have a prop. Read Torn Apart, okay? That's Dorothy Roberts.
There's a chapter in there about me.
Okay. And read Joyce's book when she writes it. I think making sure that social work students are exposed to the conversation that is happening, it has been happening for a really long time, is important. I also don't think social work schools are really making sure that students understand white supremacy and the white supremacy roots of every single one of these systems, not just the family policing and the criminal legal system, public benefits, healthcare, every one of these systems in which we operate and work and supposedly support people are rooted in white supremacy. And we are a part of that and have to understand that history and understand that context when we are walking into the spaces where we work.
Mhm.
Yeah, and that was one of the things I really wanted to get to today. Yeah, so social workers, we've been involved in everything. They were recruited for the Tuskegee experiment. They were recruited in the Japanese internment camp. Social workers have been working in every stage of white supremacy in this country. And so it's no surprise that the family policing system has followed suit in that same way.
But you know, just like CPS, social workers have also co-opted language. Just literally yesterday, a parent that we all know, I'm not going to say her name, reached out to me. Her son was being suspended from school for playing in the hallway, roughhousing with a friend. And they told me after the suspension, because of course I attended the hearing with her, they were going to do restorative practices. I said, no, you're not, because restorative practices are not after punishment, they're in lieu of. And they had a problem understanding that concept. It was the most, it was the craziest thing trying to get the school to understand why we don't punish and then. And I'm like, you know, he's a 14-year-old boy. Of course, he's got a roughhouse with his friends. Is school the right atmosphere to do that? You know, it's not. But why do we need to punish for everything? Why can't we just simply have a conversation? Why do white kids get an extended day in school, right? What do they call it? You stay a little longer so that you can learn your lesson, and Black kids get suspended. And this is part of the partnership that happens where we're criminalized and demonized every step of the way, because when this kid continues to miss school for the silly things he will do throughout his adolescent years, eventually he's going to get tired of being treated that way in school, and probably he's going to stop coming back, right? So social worker was in the meeting from that school, and she didn't understand either. She was the one who said, well, we're going to do the restorative practices after.
The restorative practices have been co-opted by the punishing systems in every space. They are the alternative to incarceration programs that are the restorative justice lens. And they are social workers that run the programs that then advocate for what they call a therapeutic remand. That is, go to jail. You go to jail because you haven't complied with the requirements, the extensive, unbelievably impossible requirements of really intensive alternative to incarceration programs. And the drug courts, go ahead, Kassandra.
The thing is, like, when we've created these alternatives, some people choose incarceration than the alternative that is supposed to be helping them, because it's the same shit. And it's even more, it takes up more time, right? And this idea, my biggest thing that I consistently say, especially about drug courts, is like, if you want to help someone navigate addiction, just help them navigate addiction. You don't have to threaten them with incarceration so they get help. And this goes back to my point. It's like, you cannot mix helping and punishing. You are not supposed to mix them. And when we talk about people like Stacey Patton also talks about parenting, right? And there's also that concept of like, it's the concept of also corporal punishment, right? Like there's this thing that we have to navigate through about that love is not supposed to hurt. We have to stop giving these mixed messages. And, you know, this is a conversation that I prefer to have in all Black spaces when I talk about like hitting and discipline and all those conversations. But there's a line between that and the system, right? And this is what I'm saying, we're doing the work of the system in multiple ways, and that we have to really untake those things out. And this point that Caitlin, you're making around like restorative justice, and that Joyce is making around alternatives to incarceration, they're not real alternatives. And the alternative is that we wouldn't have the threat of incarceration. We wouldn't have the same practices of coercion in whatever way that we're trying to support people. That is harder. It is harder to help without the threat of coercion. It's harder. As someone that, like, I'm not going to sit up here and act like my family members that navigate addiction like that. It's not harder to be the way that we are taught. It is definitely harder. And I think it's important for our side to stop lying to people. Stop lying to people that are stressed out when they're seeing their pregnant cousin who's still using drugs. like 9 months in, and you're just like, oh yeah, abolition. It's harder. It is harder to figure out how to support people in chaos. And our side has to be honest about that. Because part of the reason why people want to do what we're fighting against is because it's easier, because we can ignore it, because we lock people away. But staring at chaos is hard. And as social workers, if Joyce, if you're saying we got to change the way that we work as opposed to not as opposed to not being what we are, then we actually need to figure out what it means to help people when it's scary. Mm-hmm. Because we can't stop. We got to stop lying to people and acting as if the way that we want to go is easy, because it's not.
It's a lot easier when you respect people. I'm working with a young man right now who's in foster care, 22 years old, right? And everyone that I've come into contact with in reference to this child has said he's angry, he's volatile, he's this, he's that. And I've been working with him for over a year, and I don't experience any of that. And the reason I don't experience it is because I don't gaslight him and I don't mistreat him. I listen to him and I offer real solutions or alternatives and give valuable suggestions with options. You don't have to take it. I'm not shoving it down his throat and choking him with it.
Yep.
Yeah.
And so he's not disrespectful. He's not the things that they say. They just need to stop gaslighting and causing harm. Help isn't help if it doesn't help.
Say that again.
Help is not help if it does not help.
Yeah, it is.
I think the first question that was actually posed by the audience members goes so well with this. This is Maggie. She says, I work in addiction medicine. What resources would you recommend to a pregnant person to allow them to best advocate for themselves during pregnancy and delivery? And I imagine the context of this is someone that is struggling with addiction. This is not someone that just got tested. So
read that question again, Lauren.
One more time. Yeah. I work in addiction medicine. What resources would you recommend to a pregnant patient to allow them to best advocate for themselves during pregnancy and delivery?
I think that's a loaded question. I like to take the first stab at that. I think that's the loaded question. And the reason why I think it's a loaded question, because it's not about that person. We talked about autonomy earlier. What is it that I can tell you that will make you leave that person alone? What is it that you're doing that's putting that person in a position where they need to advocate for themselves? What is it that your agency is doing? What has the government encouraged you to do through your place of employment? That's the real question. I'll wait for an answer from them. Tell me if they go back in the chat. I mean, that's what this is about, right? That's what this whole conversation is about, giving people the autonomy to make choices. Why does she have to advocate for herself? Who is she trying to sell her right to?
Mm-hmm. Mm-hmm.
Who is she trying to convince that it's okay that she make these choices for herself?
And what aren't you doing that she has to go into a situation for her to advocate? If you want to provide support for a pregnant person that is using drugs in their recovery, in their delivery during that process, then you as an addiction medicine at that institution, what are the practices that you are shifting, that you are doing, that you are literally changing the conditions that that person walks into? That person has to give birth. That's hard enough. Mm-hmm. And if the person is Black, they might not make it. So, maybe
less than the substance.
Listen, and so like, part of it is like, I understand why the question comes, and I think what Joyce is forcing us to recognize is like, why do they have to advocate? What are you doing to change the conditions when that person walks in the door? Before, like, there's homework that you have to do before that person comes in, right? So if you have a patient who is, you meet the patient at 3 months, what is the work that you're doing in the next 6 months so that when that person walks in that door, that they're not going to experience what you fear?
That's it. That's what this whole panel is for. And I feel like one person is going to walk away knowing how to do their job better. So I feel like this panel has been a success. Thank you, Lauren. Thank you, Alan, Cassandra, and Caitlin.
And thank you all for helping me throw all the questions away, basically, because I'm just like, this whole thing, I'm just flying by the seat of my pants. And because you are all the experts, right? Like I'm in school trying to learn, and I really appreciate your all expertise. And I'm curious, just one maybe takeaway, maybe we can just go around, one key takeaway social workers need to know.
Stop giving advice and ask people what they want, and then figure out if you can help them with that.
I'm gonna co-sign that, and I'm gonna say, know your power. Your words have power. Everything you do and say as a social worker has power. And so, like, take a beat before you talk, before you ask a question, before you pick up the phone.
And I'll just reiterate all of that and add what I said before, that change from the inside is not possible. We've tried and failed. Abolition is the only solution.
And I would say, if you are a social worker, join a parents' rights organizing group. Either PLAN, if you're in New York, JMacForFamily, Movement for Family Power, Up-End, Shriver Center. There are multiple groups of parents that are organizing for their rights. There's people that are part of the repeal.
Off, Cassandra, I'm not afraid to say things out loud. Take Shriver off.
Okay, no worries.
Shriver no longer they have dismantled the people who was advocating for change. They're no longer abolitionists. Take them off.
All right, they're off.
I said it in public. First heard right here on NAP.
The Repeal AFSA campaign that's happening, the National Council for Women and Girls, formerly Incarcerated Women and Girls. These are all groups that are actively working and organizing with parents. If you are a social worker and you're trying to figure out how you can fit in, ask them if you can make a PowerPoint for them. Ask them if you can go get some coffee for them. Ask them if you can give money to their organizing groups. Ask them if you can drive them to do some lobbying visits. Ask them if you can make copies. Be of use. Don't go in there telling them what they need to do. They know what they need to do. Be of use.